Here's my 4 people. Okay. According to an article entitled World IBD Day, May 19, 2017, approximately 3 million adults in the United States self-reported having a diagnosis of IBD, representing a large increase from less than 2 million in 1999, myself being one of those 3 million adults. According to a book by Gary Lichtenstein entitled Ulcerative Colitis, The Complete Guide to Medical Management, the origin of ulcerative colitis can be traced back to 722 BS, when China's canon of internal medicine described an illness of abdominal pain, diarrhea, and rectal bleeding. Between the years of 640 BS and 120 AD, different people referred to a type of chronic diarrhea associated with blood and ulcerations of the bowel that was different from other types of diarrhea. Knowledge was insufficient at that time to definitely diagnose their disorders, but the profile reasonably fits the description of ulcerative colitis known today. World IBD Day is recognized on May 19th to recognize awareness of inflammatory bowel disease and the 2 conditions that compromise it, ulcerative colitis and Crohn's disease. I will focus in on ulcerative colitis. Ulcerative colitis is a serious chronic disease that cannot be prevented or cured. It increases the chances of obtaining colon cancer and other diseases and cancers. I will discuss what ulcerative colitis is, symptoms of such disease, and the different types of treatment that are available for ulcerative colitis patients. To start off, I will explain what ulcerative colitis is. According to the World IBD Day, May 19, 2017 article, ulcerative colitis is a chronic disease that causes chronic inflammation of the gastrointestinal tract. Let's first explain the difference between UC, or ulcerative colitis, and Crohn's disease. Ulcerative colitis occurs mainly inside of the colon or large intestine. If you look at the diagram I have provided, you will notice the labeled colon, starting from the bottom of the appendix, going up the ascending colon, through the transverse colon, down the descending colon, and out the rectum. UC impacts the inside of the entire colon due to ulcers forming. Crohn's disease occurs and impacts the outside of the colon and can spread more throughout the GI tract, including the mouth. Both diseases experience the same symptoms, but are not contagious to other people around them. Inflammation occurs a lot outside of the body when you have ulcerative colitis. It is the body's natural response to danger. According to the science of anti-inflammation diets, inflammation is the release of chemicals from white blood cells into the blood flow to protect a part of your body. The aim of releasing chemicals is to remove toxic cells, pathogens, stimuli, or other irritants, and repair damaged tissue. Have you ever wondered how you actually get or possess IBD? IBD is also an autoimmune disease. According to Andrew Warner and Amy Bartow, the immune system functions like a defense system, guarding our bodies against the attacks from bacteria, viruses, and parasites. IBD occurs when the body's immune system becomes confused and starts attacking normal organs and cells, believing that they are foreign. Medical professionals do not yet understand why this happens. Although today IBD cannot be prevented, there are many ways to manage your symptoms and prevent complications with your disease. A person may experience many symptoms before being diagnosed with ulcerative colitis. If a person does not experience symptoms before then, it's very rare. Symptoms, according to the World IBD May 19, 2017 article, include frequent diarrhea, abdominal pain, and bloody stools. Other symptoms may be fever, weight loss, fatigue, and night sweats. The cause of ulcerative colitis is not known. However, the World IBD Day, May 19, 2017 article states that genetic susceptibilities, problems with immune systems, and environmental exposures, such as smoking and certain microorganisms, all may play a role. Finally, I will discuss the treatments for ulcerative colitis. There are various treatments for ulcerative colitis available to any patient. Drugs is one treatment option that many patients start out with. Anti-inflammatory drugs such as ibuprofen most of the time worsen symptoms for patients, but according to the Mayo Clinic staff, Sulfasalazine and corticosteroids may help patients. The Mayo Clinic staff also recommends immune system suppressors for many patients. Azathioprine is the most widely taken immune system suppressor. Patients regularly taking this medication need to check in with their doctor and get blood checks regularly. Biologic medications such as Remicade, Entyvio, and Humira are mainly for those who don't respond to or tolerate other treatment. Those three biologics all increase the risk of cancers and infections for any patient. The Mayo Clinic staff also uses surgery to treat ulcerative colitis. Surgery often eliminates UC, however, it also means removing your large intestine or colon. The after effects of surgery are that your surgeon constructs a bag to collect stool that needs emptied every so often, and it's constructed from the end of the small intestine, which is still intact after surgery. In conclusion, ulcerative colitis is a chronic condition that causes a variety of bowel symptoms. The reason for obtaining this irritable bowel disease is unknown. Treatments for ulcerative colitis are normally chosen between drugs and surgery. Generally, anyone with a genetic history of bowel diseases may become diagnosed with ulcerative colitis. However, there are people and families who happen to be the guinea pigs, which causes some confusion with medical professionals. If diagnosed, we can decrease our symptoms knowing the facts and getting treated properly. Thank you.